Welcome, Brian Schroeder, to the Wellness Law Podcast. Thank you so much for joining me. Everyone I met Brian, I don't know, years ago through the National Wellness Institute. He was the president of the board of directors for the National Wellness Institute for many years. And he is also the founder of Preventia. And he's going to tell us a little bit about that company. And I just want to say welcome to the Wellness Law Podcast.
Thanks for having me, Barbara. Good to be here today.
Well, the first question is, tell us about Preventia and why you started it.
Yeah, sure thing. So again, I'm Brian. I founded this company, Preventia, here in 2017. But prior to doing that, as you mentioned, I did have a little stint, about 7 to 8 years. It sure felt like longer than that, even where we first met, serving as the president of the board at the National Wellness Institute. But how I even got there was I had been in healthcare for about 20 years prior to that, and really prior to starting this company. Most of my work was serving underserved populations, Barbara. I think you and I have talked about that a lot in the past, but really working with the underserved to stand up models of care that actually made a difference in their lives. This is what I would call, getting into well care versus sick care, which is what I did before getting into well care. I managed physician practices, anything from pediatric cardiology to labor and delivery units. I was dabbling in many primary and sort of specialty care types of sick care. In 2013, my wife was diagnosed with heart failure, otherwise known as cardiomyopathy, after she gave birth to my daughter, Isabel. So when my wife was diagnosed with this, I was working more in the sick care environment, and I watched her struggle to get better. And so I decided that I would get into this completely other side of healthcare that I didn't even know existed. I ran into an old friend who was running something called wellness, didn't know what it was, but thought I would throw my hat into the ring, and everything was history from there. So my job, Barbara,
What were they running in wellness? You said they were running something in wellness.
they had just started it. It was interesting. They didn't know either. They just
Oh,
knew that they had a budget, they had a supportive CEO, and they needed somebody to come in and be a bit of an entrepreneur and sort of grow it from scratch. And that's what I was hired to do. So my job, it was to test solutions, go out and bring in vendors, maybe buy some wellness solutions that were the Virgin Pulses of the world, some of those bigger platforms, or, we had a health coaching practice on site. It might be trying to integrate health coaching with occupational health or something like that. Whatever we could do, it was create a plan, put that plan into place, use the employees as a laboratory to test what works well and what doesn't, and then ultimately roll that out with the patient population. And that's really what my job was. And that's how I got into wellness. Now, as far as Preventia goes, it was really the result, Barbara, of doing that work, testing things that worked and what didn't. So we stood up a lifestyle medicine clinic all the way back in 2015. And I learned that it wasn't, after studying it and testing it, that it was an amazing solution that produced statistically significant outcomes, but it wasn't scalable. The reason it wasn't scalable is because we had enough doctors to diagnose and treat patients, but what we didn't have were the practitioners that were needed to help patients execute on the plan. So when you go back to my wife, right, she was diagnosed with this heart condition, and she was told that she needs to eat healthy, move more, stress less. And that's so easy to do, right? Well, it wasn't. How does she execute on the plan? She needed a coach. So I got a lot more into coaching and started studying it. And I realized that I was never going to be able to touch patients as frequently as I would need to inside the walls of the hospital, because they don't spend their money there. That's not a money making, profession for them. That's not something that's got a CPT code attached to it that's going to generate any revenue for the hospital. So I started thinking bigger, and how might I scale this? And I decided, after many years of frustration, to quit a job and get out of it and, start Preventia, which is really focusing on management of habit behavior and mental well-being, but really connecting patients who need coaching with coaches that need clients. And at the end of the day, that's sort of the backstory, how I got here. I always fail to mention my wife is much better now. She was told last year she no longer has heart failure, and that is incredible. news for our family. And that's because of the choices that she has made and how empowered she has become. So change is possible. I've seen it in my real life, and I'm very passionate about the work for a number of reasons, but that's kind of my why behind, everything Preventia.
Wow. Well, I actually did not know that backstory. So this is quite a treat for me to learn why you started Preventia. And so I'm excited that this podcast recording is happening. You had mentioned that the concept of lifestyle medicine and scaling that with coaches is to manage habit behavior. Now, you were talking about doing it with patients. So when you're working as Preventia, are the people you're helping primarily people who are actively being treated by physicians, and you're coming in with the lifestyle management for those patients, or are you also working with people who just want to improve their life and aren't really under the active treatment of a physician for a particular condition that needs that behavior change?
It's a loaded question. It's as an entrepreneur, and this, being an entrepreneur, you might have an idea, like your idea of exactly how it should go. And then it doesn't go that way. And then there's another pivot and another pivot in the business, which ultimately impacts the patient. I would say that when we went to market, now I founded the company in 2017, right? But we took it to market after building technology for a few years. We took it to market in Q4 2019. My target market was healthcare. So I launched it in November 2019. And within 2 weeks, we were under a global pandemic. So, no hospitals would even talk to us at the time. And the goal was to do just that, was to work with patients that were perhaps cardiometabolic,
Mhm.
co-prevalent with anxiety and depression. And they were like, high risk or rising risk patients where we could automate referrals for coaching. We pivoted under the pandemic to work with employers and other populations that were at risk, even universities. And so
Mhm.
I would think of the approach as more of, and this is where a lot of wellness programs fail, in my opinion, is we have this ability to be very prescriptive. So it's a population health model, sort of what it's evolved into. So you've got a population that exists within an employer, a university, maybe a health system where they're working with employers as well, and they're at risk or they're rising risk. GLP-1 is actually a good example of that right now. Patients that are, they're on these peptides and they're starting to lose some weight, and they're fearful that, you know, their diabetes is going to progress, or their heart disease, or their pre-diabetes. And we know that you can't just take the drug and lose weight and make that sustainable. So coaching would come alongside a program like that, apply
Mhm.
a lifestyle medicine sort of approach. And the goal would be to get people either off the GLP-1s or down to some micro dosing level that makes their weight loss sustainable. You could say that about multiple different types of conditions. Mental well-being is another one where, prevention could go into, let's say, a university, and there's an at-risk student population for mental health. Campus counseling center doesn't have enough providers to take care of that population. So they have this big wait list. So you get, patients in with coaches that can deal with the low acuity stuff and alleviate the burden on the system. So it really depends on what the needs are of a at-risk population, where that exists, and then we take it and customize it and tailor it. Very prescriptive in the approach. So again, loaded question. This is something I could talk about a lot longer than a 20-minute podcast, but that's sort of how we approach it today.
Okay. And would you say that the people who are delivering the services on behalf of Preventia are mostly coaches, or are you also working with licensed psychologists, for example, or nurse practitioners or some other licensed individuals?
We thought about that for a while, working with, different types of licensed professionals. And ultimately, we ended up just creating partnerships with like EAPs or something like that. That would be an employer assistance program that you see in a lot of employer settings where they have counselors, but
Mhm.
we're the non-clinical.
Mhm.
We are the non-clinical engine here. So I would think of prevention like you would think of any other provider network. You might at Anthem have a big network of doctors and nurse practitioners and clinical psychologists and counselors and whatever. We're the non-clinical. So we have created, yes, a technology to bring to employers, but it starts by building a network of health coaches, sometimes dietitians and nutritionists, but usually at its core, it really is a network of health coaches. These are board certified NBHWC, National Board for Health and Wellness Coaching coaches who are trained by an affiliate program of the NBHWC. So that might be Well Coaches, Dr. Sears Institute. As you know, there's a number of these certified coaching programs that put out coaches, but you have to be board certified to be on the platform. You have to maintain that board certification. You have to carry your own insurance in order to be on the platform. But you do have the ability to be on the platform if you are board certified and generate income. So that's kind of how we de-risk it is by partnering with those board certified organizations and not getting into licensure, state licensure. I don't want to worry about what's governed where.
Yeah.
It's really not core to who we are anyway. So let the
Yeah.
doctors, nurses, doctor and nurse.
Yeah. Well, you had mentioned your coaches are assigned more of the low acuity individuals, and I'm going to assume that that means, they're not suffering from major medical conditions. They are needing just some support, encouragement to engage in better behaviors and maybe break down some barriers to access those better behaviors in a more effective way.
You remember Dr. Mark Pettis, right? He was
Yes, he's
also
great.
served as he was our chief medical officer for a while at Prevention. He's now our senior medical advisor. But he's always said, and I believe this to be true, that there are none that are immune to health coaching. So it doesn't matter what their acuity level is. Let's take my wife as an example. When my wife was diagnosed with heart failure, it didn't mean that she stopped seeing her cardiologist and the coach took over. It just meant she needed someone to help walk alongside her, help execute on that plan, that she was given by the physician. And a lot of times those doctors who are trained to diagnose and treat, they don't even know what to do. So the coach's job is to tap into those intrinsic motivators, use the techniques they've learned in motivational interviewing and everything coaches do, and let them coach
Mhm,
and be that guide that walks
mhm,
alongside. So sometimes patients are high acuity. It doesn't mean that our target is always that, but if you are cardiometabolic and co-prevalent and you feel lost, working with a coach is a great option. If you just want to stay healthy and maintain that health and well-being that you believe that you have, then you might work with a coach as well to stay there. So it depends. When I talk about low acuity on the mental well-being side, it gets a little dicey, but we would want to see you working with a psychologist or, a counselor as well. This is an augmentation of
mhm.
that, not necessarily, you know, sticking with one level of acuity or another.
More complementary to the
Yes.
conventional health system. So you mentioned there's a technology, and then you've also said the word platform. I'm going to assume those two words are equivalent in your mind. That your technology that you're offering your clients is this platform, and that the coaches that you work with can access this platform. Do you want to talk a little bit about that?
Yeah, of course. Yeah. When I say platform, I mean, the suite of technologies that we have built. So, you've got a patient side, and that could be whatever population we work with where they have an application that they can download from the app store or go to the website and use that helps them find a coach, connect with them, have a telehealth visit, set goals together, message them securely. Like that's part of the technology. Then there's a whole other side of it that's for the coaching community. So this is something that, you know, we give away to the coaching community. It's a full practice management solution that helps them build their schedule, document their notes. And this is something I built into Epic years ago. I mean, this is a true coaching EMR, really. It has messaging components, telehealth capabilities. all of the stuff that coaches need to run their business. And what's great about it is they're linked. So when Prevention goes out and works with a new large client, like for instance, we just signed and began our work together with Louisiana State University, so LSU, that just started last month. And as we begin that work, people who sign up for coaches that are part of that university, they would be the coaches who have this platform. So if you use the platform to run your practice already, as long as your schedule is current, you are eligible to receive referrals from Prevention. And that helps drive revenue for your business. So there's a number of different layers to it and a number of different value propositions for the coaching community to kind of get engaged. And we will continue to build that out over time. But that's kind of how it exists today.
Yeah. Well, that sounds like a sweet deal. So if coaches were interested in learning more about maybe getting on that platform, assuming they're board certified, NBHWC board certified, how would they find out more?
So our website, prevention.care, has an area for coaches in there where they can just go sign up and download the platform. And again, this is a no strings attached type of thing. I am a huge advocate of the coaching community. And this is part of our way of giving back and helping coaches build those businesses. Because as you know, a lot of times these are stay at home moms, stay at home dads. They're making ancillary income on the side. Maybe they're working in a health system and they're trying to stand up their own practice, but they're not great at sales and marketing and don't know exactly where to begin. This is a way to begin and a way to
Hmm.
get started and maybe even generate some income. Like I mentioned, we'll see, how everything continues to progress, but it's just a simple downloading of the platform from the website. And there are a number of ways to do that, but really going to prevention.care is the best way.
All right. Well, I'll make sure I put that in the notes. One last question, though, for you, Brian. As someone who's been in the wellness space for a while and the healthcare space, where would you like to see wellness go in the future?
I don't know. I know where I've seen it going. And I feel like for a really long time, and I fell into this, I'm going to call it a bear trap. Wellness was built by organizations without naming any that focus on the fun side of wellness. And I don't think there's anything wrong with that, but gamifying wellness, challenges, incentives, walk to the moon, and you get points and all that. That's bringing, I think, a little bit of fun and culture into wellness. But I think what I'm seeing in the market, because Barb, I used to buy those. Like I used to be the guy that would vet them and bring them in and test them and see if they worked. I think the market is starting to wake up to the fact that solutions like that are probably temporary. It'll take just enough time of having those in place that you will eventually learn that they don't actually generate health outcomes. There are many that make claims that do, and I respect that. I'm not saying that they didn't generate some sort of outcomes or they don't have incredible initiatives behind them. But my thought is that when I've seen change happen, it involves a human in some way. So that person to person connection, that ability to build a relationship with someone that establishes rapport and trust is what ultimately leads to sustainable change. And I think the market is starting to wake up to that. But just like I stated in the beginning, the reason I created Prevention in the first place was because relationships and people, the human connection is very hard to scale. So how do you do that? How do you carry all of that overhead when you try to put a couple coaches on site, but yet you've got 50 locations,
Hmm.
as an employer? Or if you're a health system and you have, like I had 6 health coaches, but a million outpatient visits a year. How was I ever going to go from program to sustainable results over time that really explodes? You can't do it. We have to figure out a way to scale the relationships. And I
Hmm.
feel like that's where I'd like to see wellness go. Some of the science that kind of walks alongside that right now, I'm particularly fascinated by peptides, not just the GLP-1s, but human growth hormones, the tissue repair, all the other stuff that the bodybuilding community has known about forever. Some of these biohackers that are out there. Some of this is really at the vanguard of big change. And sometimes we just need a nudge, a little bit of a nudge to get ourselves going, but we still need that human connection to make it sustainable. So that's where I see it going. It's where I'd like to see it go. I feel like we're getting really close, actually.
So you're not a proponent of using AI for wellness. You don't think that's gonna be as a
I am, as long as it doesn't replace the human connection. There, just like prevention can augment the work that a doctor does, I do believe that AI can augment the work that a coach does. So, like, if you've got questions around nutrition or sleep or physical activity in between meetings with a coach, and you want to ask AI about some things that you can do or some recipes that you can learn more about the science, you're you've got a coach for 20, 30 minutes.
Mhm,
You've got AI every day, all day. Dig
mhm.
into as much as you want. And then you use that information to ask meaningful questions to a coach. Hey, I learned this. I saw that. What do you think about that? So I do think there's a place for that to help it scale and to take a little pressure off of just the coach patient relationship, coach client relationship. So no, I'm not against it at all. I'm actually thinking of ways I can incorporate it more into our technology, but I think it's dangerous to replace AI coaches with human coaches.
Mhm. I think that's a good balance. I agree. AI can definitely be good, a good augmenter, as you say. So, well, a lot of fascinating things on the horizon for you and for wellness in general. And I can't thank you enough for giving your time. I know you're very busy with all of your initiatives. So thank you so much for sharing your wisdom and experience and your why with us at the Wellness Law Podcast. And I wish you the best. And of course, if you're listening and you want to learn more, preventia.care. I will have the link in the notes. And thanks again, Brian.
Hey, thanks for having me again, Barbara. Great to see you as always.